Good morning, ladies and gentlemen. Today we're going to talk about food allergies for health section. Many people actually suffer nowadays of these problems, these issues, notably 46% in children and up to 4% in adults. These data are provided from the Centers for Disease Control and Prevention. Now, food allergy symptoms are most common in babies and children, but they can actually appear at any age. You can even develop an allergy to foods that you have eaten for years with no problems. So that can actually happen. The body's immune system keeps you healthy by fighting off the infections and other dangers to be in good health. Now, food allergy reaction occurs when your immune system overreacts to a food or substance that is contained in food. Identify this substance as a danger that actually triggers the protective response. Now, while allergies tend to run in families, it is impossible to predict whether a child will inherit a parent's food allergy or whether siblings will have a similar condition. Now, symptoms of a food allergy can range from mild to severe, but pay attention. Just because an initial reaction can cause a few problems, it doesn't mean that all reactions will be similar. In fact, a food that triggers mild symptoms on one occasion might cause more severe symptoms on following occasions. So just keep this in mind. Now, the most severe allergic reaction goes under the name of anaphylaxis, which is life-threatening, a whole body allergic reaction that can impair your breathing, causing a dramatic drop in your blood pressure and affecting your heart rate. Anaphylaxis can come like immediately or within minutes of exposure to the trigger food. It can be fatal and must be treated promptly with an injection of epinephrine or adrenaline. While any food can cause an adverse reaction, only a few of them account for about 90% of all reactions. These are called the allergens. Some examples, of course, eggs, milk, dairy products, peanuts, tree nuts, fish, shellfish, wheat, soy, sulfurous anhydride, lupin beans, celery, and mustard. Symptoms of an allergic reaction may involve the skin, the gastrointestinal tract, the cardiovascular system, and the respiratory tract. They can surface in one or more of the following ways, like vomiting or stomach cramps, hives, shortness of breath, wheezing, repetitive cough, shock or circulatory collapse, tight, hoarse throat, trouble swallowing, swallowing of the tongue affecting the ability of talking or breathing, weak pulse, pale or blue coloring of the skin, dizziness or fainting, and of course, as we just mentioned, the anaphylaxis. Most of food-related symptoms occur within 2 hours of ingestion, and often they start within minutes. In some very rare cases, the reaction may be delayed by 4 to 6 hours or even longer, but that's quite rare. Not everyone who experiences symptoms after eating certain foods has a food allergy or needs to avoid that food entirely, of course. For instance, some people experience an itchy mouth or throat after eating raw or uncooked fruit or vegetable. This may indicate oral allergy syndrome, which is a reaction to pollen there is not a reaction to it, to the food itself. As we previously said, once the food allergy is diagnosed, the most effective treatment remains to avoid that kind of food. Children are usually affected by milk, eggs, and peanuts, and notably they can outgrow their allergic reactions to milk and to eggs, but peanuts and tree nuts allergies can persist. Whereas in adults, the most common allergens are fruit and vegetables, pollen, of course, which causes oral allergy syndromes, peanuts and tree nuts, fish and shellfish. Now, people allergic to a specific food may also potentially have a reaction to related foods. For example, if we have a subject allergic to one specific tree nut, this can also be cross-reactive to others. So those allergic to shrimp may react to crab and lobster. Someone allergic to peanuts could react or could have other problems with tree nuts or pecans, walnuts, almonds, and cashews. But now, learning about patterns of cross-reactivity and what must be avoided is one of the reasons why people with food allergies should always receive care from a board-certified allergist. Determining if you are cross-reactive is not straightforward, of course. Allergy testing to many items in the same family may not be specific enough, and many times these tests are positive, given how similar two food items in a family may look to the test. If you have tolerated it well in the past, a food that is theoretical cross-reactive may not have to be avoided at all. So a food allergy will usually cause some sort of reaction every time the trigger food is eaten. Symptoms can vary from person to person, and you may not always experience the same symptoms. Allergic reaction to food can affect the skin, the respiratory tract, gastrointestinal tract, and cardiovascular system. It is impossible to predict how severe the next reaction might be, and all patients with food allergies should definitely be very careful and just try to predict the anaphylaxis reaction. If you suspect a food allergy, see an allergist who will take your family and medical history into examination and decide what kind of tests to perform and use this information to determine if a food allergy exists or not. In order to make a diagnosis, allergists ask detailed questions about your medical history, about your symptoms, so be prepared to answer questions like what kind of food have you eaten, how long did it take the symptoms to appear, what kind of symptoms did you experience, and how long did they last. And also, after taking your history, your allergist may order skin tests and or blood tests, which indicate whether food-specific immunoglobulin IgE antibodies are present in your body. Some of the tests the main test that is taken and is run all the time, most of the times actually, is the skin prick test, which provides results in about 20 minutes, which is a liquid containing a tiny amount of the food allergen that is causing the reaction, is actually placed on the skin on your arm or back. And then your skin is pricked with a small sterile probe, allowing the liquid to steep around the skin. The test, which isn't painful at all, can be uncomfortable just because you might see an allergic reaction at that point. So the test is considered positive if you see a little bump in the specific area where the liquid is applied. Now, blood tests, which are not specific as skin tests, can measure the amount of IgE antibodies to the specific food being tested. The results are typically available in about a week. In some cases, an allergist may wish to conduct an oral food challenge. This is the most accurate test, actually, but it has to be conducted under strict medical supervision, and the patient is fed with a tiny amount of the suspected trigger food in an increasing doses over a period of time. This is followed by a period of observation to see if a reaction occurs. Of course, this test is helpful when the patient history is unclear and if the skin or blood tests are inconclusive. It also can be used to determine if an allergy has been outgrown, and because of the possibility of the severe reaction, an oral food challenge should always be conducted and only be conducted by experienced allergists in a doctor's office or in a food challenge center with emergency medication and equipment on hand. Now, how do we treat a food allergy? Well, obviously, the primary way to avoid allergy is to avoid that food. Now carefully check all the ingredients when you buy some food, and labels, and see what is contained in the specific preparation. Also, many people with food allergies wonder whether their condition is permanent. Well, there is no definite answer. Allergies to milk, eggs, and soy may disappear over time, whereas allergies to peanuts, tree nuts, fish, and shellfish tend to be lifelong. Be extra careful when you eat in restaurants. Ask always the waiter what is contained in the food you're ordering. If the waiter doesn't know, please ask to, ask the same question to the cook, who might actually know what is contained in the food. When a situation of anaphylaxis occurs, adrenaline or epinephrine is the first line treatment. So anaphylaxis can occur within seconds or minutes of exposure to the allergen, and can worsen quite quickly and be fatal. Once you've been diagnosed with a food allergy, your allergist should prescribe an epinephrine auto-injector and teach you how to use it. You should also be given a written treatment plan describing what medications you've been given and what kind of medication you should avoid. Anyone with a food allergy should always have his or her auto-injector available. Better to have 2 doses ready, as the severe reaction can recur in about 20% of individuals. There are no data to help to predict who may need a second dose of epinephrine, so this recommendation applies to all patients with food allergies. So in case of severe symptoms such as shortness of breath, repetitive coughing, weak pulse, hives, tightness of your throat, trouble breathing or swallowing, or in a combination of these symptoms, in different areas of course, immediately inject this adrenaline dose. In addition, you should be taken to the emergency room as soon as possible. If you're uncertain whether the reaction warrants epinephrine, use it right away anyway, as the benefits of epinephrine far outweigh the risk of side effects of epinephrine. Now, what can food allergies be prevented overall? Now, in 2013, the American Academy of Pediatrics published a study that supported earlier researcher suggesting that feeding solid food to very young babies could promote allergies. So the specialists started recommending against introducing solid food to babies younger than 17 weeks. They also suggested exclusively breastfeeding for as long as possible. But research on the benefits of feeding hypoallergenic formulas to high-risk children is controversial anyway. The timing of introduction of certain foods is also being investigated as a means of prevention. The general practice in Western countries is to delay the introduction of highly allergenic foods such as peanuts, tree nuts, seafood until the age of 3 years old. There is newer but not yet proven data suggesting that introducing this food in a baby's first year may actually help the child tolerate the food. The bottom line, anyway, is that the timing of when to introduce foods remains confusing and somewhat controversial. I hope this video has been helpful in some ways. If you have any questions, please do not hesitate to write in an email to raf.pilla@gmail.com. Again, raf.pilla@gmail.com. Thank you for watching.